see you. This is the Awuse. Put your hands together for him. Thank you, sir. I was hearing this name while I was in primary school. And by privilege, I'm saying, you're welcome, sir. God bless you, sir. We also have in our midst today His Royal Majesty, King Barrister Onye Kachi, the Amawa, DSS ROS, Eze Omuma of ancient Omuma Kingdom, a first-class chief of Nigeria. Please, can you put your hands together for him? Eze Omuma. He is now standing in for the chairman of Traditional Rulers Council of Rivers State. Sir, you are welcome. You are welcome, sir. Thank you, sir. Thank you, sir. You look very handsome, sir. Thank you, sir. You are welcome, sir. Please, Mr. Josiah, can you come close to me? Please, someone should signal me once. We are still expecting the president of CAN. The president of CAN. We are still expecting. Once he arrives, please, we want to, the chairman of CAN, or PFM, we want to recognize them specially. While we are still doing the introductions, please, if you have not written the attendance, please, you can signify by raising your hand. The ushers, please watch out. Anybody that raises his or her hand so that you can attend to the person, bring the attendance sheet right inside the hall so that our royal fathers can put their names. Ladies and gentlemen, still on, we have His Royal Majesty Eze Felix. His Royal Majesty Eze Felix Otuwarikpo. Eze Felix Otuwarikpo. Eze Okpata of Okpata Kingdom. Put your hands together for him. He is a first-class chief. Eze Okpata of Okpata Kingdom. I think this must be in our other side. Thank you, sir. You're welcome, sir. You're welcome. Still on, we have also seated with us His Royal Majesty Eze Honorable Okpokri, the Eze Ubia of Ekpe Nation. The Eze of Ekpe Nation. Can we put our hands together for him? Eze Honorable Okpokri, thank you for coming. Thank you for honoring us. We also have His Royal Majesty Ambassador G.T. Williams Atande, the Okama of Agbakwan Asrama. You are welcome. We celebrate you, sir. God bless you. Please, can you wave us? Let's see you. God bless you. You are welcome. Thank you very much. Thank you, sir. Still on. Please, we want to welcome, we will be recognizing the ministers of the gospel that are here. Please, ushers, watch out and let me have the president of CAN. Josiah, please come. We have a lot of royal fathers that are here. We have chiefs. We have second class, third class, and all the classes of chiefs that are here. Truly, we will not be able to recognize all, but indeed, we will not be able to call us one after the other. We recognize you and we celebrate you. Can we put our hands together for all the chiefs, the kings that are here? Please clap for them. Clap for them. We are honored to have them in our midst. Just as we were introducing, we also have walked in right here, the chairman of this very occasion. The chairman of this occasion, he appeared so simply and very boboish today. And almost I wouldn't have recognized him, but I had to look carefully because I saw him yesterday, and I understand. So please, ladies and gentlemen, can we bid a welcome to the chairman of this occasion, Ambassador Wikpo Victor Solesi. Let's put our hands together for him. Can you see how handsome he is? You're welcome, sir. You're welcome. Thank you very much for coming. Thank you. Please, we will continue the recognition as they are coming in. I understand a lot of dignitaries are still walking in. We will not stop. We will continue to recognize till the program ends, even though we will not be able to call all the lists. Ladies and gentlemen, join me as I also welcome and recognize the chairman of the Indigenous Bishop and Ministers Forum, Niger Delta Indigenous Bishop and Ministers Forum, led by His Eminence, Archbishop Julius Edewi. His Eminence, Archbishop Julius. Sir, please, can we see you, sir? Can we see you? Where is he? Oh, please, you need protocol. You need to bring him closer. Please also confirm the Muslim communities once they are here. Please, we need to. All right, thank you very much. So we will run now. We are going to move with speed. Let's also quickly recognize Reverend Obina. Reverend Obina and his wife, Pastor Chinwe. Please, you are welcome. This is the dear pastor of our ears. We celebrate you, the Trim South Zone 1. You are welcome, sir. Please, sir, where are you? Can you just wave your hands? We love you. We celebrate you. Put your hands together for him. That's a fire that is driving the ears. Thank you very much. Thank you. Thank you. In that same vein, let's recognize Right Reverend Kenneth Menele, the Bishop of Kano Diocese of Methodist Church. Sir, you are welcome. We love you. We celebrate you. Please, can you help clap for these persons now? We also recognize the presence of Reverend Dr. Samuel H. Awajinte, JP, and General Overseer, Rito Ministry International. God bless you. Thank you for coming. We celebrate you. You are welcome. We also recognize the presence, Reverend Steve Lelebare. You are welcome. Reverend Steve, you are welcome. We celebrate you. God bless you. Thank you for coming. We also recognize and celebrate the presence of our dear Pastor Jackson of the Winners Chapel International. Pastor Jackson, we celebrate you. You are welcome. You and your dear wife. God bless you. Thank you for coming. At this point, we'll be running. We will continue the recognition. The list is endless. We will continue the recognition. But we have to start the program in earnest. We also recognize the presence of the Nigeria Red Cross Society, all the civil society organizations that are here, the CSOs, River State, all of you, you are welcome. Thank you very much for coming. God bless you all in Jesus' name. Please, can you put your hands together for yourself? Ladies and gentlemen, put your hands together for yourself. Let me just quickly recognize all the management staff of River State Contributory Health Protection Program. Management staff, please, can you just stand and wave your hand? Management staff, stand now. Wave your hand. Wonderful people. Clap for them. Clap for them. These are the people that put together this wonderful program. And we also have some of the board members of River State Contributory Health Protection Program. I can see Pharmacist Promise. Pharmacist Promise, please. Look at him there. Please, camera capture his face. He's in the front. Camera capture him now. You look at him, he's smiling, yes. And right beside him is our own very Dr. Jaja. Dr. Jaja, you are welcome. You are welcome. I can also see our madam. She was here yesterday and she's here again. Beautifully dressed. You are welcome, ma. God bless you. Primary Healthcare Management Board is ably represented here. We recognize you all. Thank you all for coming. God bless you. Please sit tight. Today's program is going to be very impacting. It's a wonderful one. You have never seen this kind. It's great. Now, this program is a digital program. A lot of things that is going to be happening is digital. Do know that you are on a live. So whatever you're doing, your daughter is seeing you if she's online. Your son, they are seeing you. So we need to organize ourselves. God bless you. We will quickly welcome the EAs, the Executive Secretary. But before then, please, ladies and gentlemen, help me recognize Dr. Ofo. Dr. Ofo is in the house. Welcome, ma. She's a board member of Riverside Contributory Health Protection Program. Let's please clap for her. Thank you and welcome, ma. The Executive Secretary of Riverside Contributory Health Protection Program, the woman through whom God is doing these great things you are going to see, you are going to hear about this morning. She is an amiable woman, full of intellect, a capacity ES that has been leading Riverside Contributory Health Protection Program to this point. Ladies and gentlemen, can we give her a clap as she walks into the podium for an opening remark?
Thank you very much, Mark Moses. Our royal father, I have adopted him. Father, I'm waiting for my end. The Baka Baka is officially my father. Can we clap to that? Thank you, sir. Your Royal Majesty, thank you so much. Proud. My own king. You know, I'm from Emoha local government area. So he does chairman of the South South Forum of Monarchs. Yeah. Meet you, sir. Everyone that are in. Chairman of the traditional rulers. My latest father. Adoption was this morning. We are signing agreement. By the end of the day, I will be having so many fathers. Maybe you have only one mother, but have many fathers. Our religious leaders here, chairman of the Christian Association area, and all the bishops in the house, all the first, second, and third class chiefs, everyone in this room is so important. It will be an error for me to begin to name names. The heads of civil society organizations, the heads of community-based organizations. I see my mother in the Medical Women's Association of Nigeria. If you call her, I'm sure that I will live here on peace. My own doctor, Bernadette Kruger. I know she's somewhere in this hall, but and she ladies and gentlemen of gives me great pleasure to welcome you to strategic engagement with community leaders, religious leaders, leaders of CEOs and PSOs in River State for the purpose of communicating the vision of His Excellency Siminalayi Fubara, PSSRS, as touching health. It is the governor's vision that everyone that lives and works in River State can access healthcare when they need it without going through financial hardship. So he has mandated us by ensuring the operationalization of the River State Contributory Protection Program to make sure that we go around our communities and have people registered. I don't know why we are not clapping for our governor. If you're not clapping, you're wrong. Distinguished guests here, Reef Chip started in 2024 operationally, but in 2021, the law was signed establishing this organization as an agency of the Ministry of Health. Since the inception, we are already covering over 145,000 lives across the 23 local government areas of River State. In the course of today, we'll get to hear more about the operations of this agency. We'll get to hear some testimonies from members of our communities that have benefited from this program. But the reason for this meeting is because in the course of our implementation in the last 2 years, we have noticed a number of gaps. Remember, the governor wants us to access health care. even though it's affordable, but the word that resonates with us always is quality. So that it is cheap or affordable or is free of us does not mean it should be of poor quality. And so in our monitoring and supervisory visits, in evaluating some of our programs, we found a big gap in the communities. And so that's why we thought it wise to bring together our community leaders. Yesterday, ward development committees and the community development committee chairman, women leader, and youth leaders were all here and made commitments to see that our community members can actually access this healthcare just the way the governor wants them to, without going through financial hardship. So I want to therefore encourage all participants to actively listen, engage constructively, and contribute meaningfully during the interactive session, because we need your perspectives, your insights, and experiences. They will be invaluable as we collectively identify practical strategies to strengthen community coordination and expand the reach of the program. Together, we can ensure that no resident in Rivers State is denied access to quality health care due to financial barriers. So once again, I warmly welcome you all, and I thank you for coming and for your commitment to improving the health and well-being of our people. God bless Rivers State. Thank you, and God bless you.
Is that how you clap for the executive secretary? Please, you can do it better. You can do it better. You can do it better. Don't worry, you're going to hear mind-blowing testimony. The great things God has been doing using this humble woman in Rivers State and beyond. And then I'm sure your clapping will be more energized. Thank you so very much. Let's also, still recognizing in the house, we have the Chief Imam Khalid Ayelowo, the Muslim leader of Akpo Kingdom in Rumelimini, is right here. Please, the Imam, please, can you wave your hands for us to see? All right. You are highly welcome. Welcome, sir. Thank you. We also have in the house Professor XC Reverend Achinehu. Prof, you are welcome. Thank you very much for honoring this invitation. Thank you. We also have the Director of Women Affairs, International Human Rights Protection Services, South. Director of Women Affairs, International Human Rights Protection Service, South, Evangelist Mrs. Mary Chijoke. And let me especially recognize Mrs. Uloma Joseph, one of the board members. I need to recognize her. These are board members of Reef Chip. Hey. Please, ma, can you stand for a special recognition? Put your hands together for her. Clap for her now. Yesterday she was here, and she's here again. Thank you very much. Thank you. Distinguished board members of Reef Chip, you are all welcome, and entire management board. Thank you. So proceeding on our program today, we are running with the speed of light. As I earlier said, everything we are doing is online. It's a live program. It's covered live. We'll be welcoming the chairman of this occasion for a very brief opening remark. The chairman of the occasion, please, can we put our hands together as we welcome Ambassador Victor Solesi. You are welcome, sir.
You are welcome to this program. Your Excellency, the Deputy Governor of Rivers State, Professor Ngozi Odu, ESS, Chairman of the Board, Rivers State Contributory Health Protection, Professor Prince Sweet, ESS, Executive Secretary, Dr. Betty Ala, Royal Father of the Day, Royal Highness Eze Asilia A.K. Unyereshi Elewoji, English traditional rulers, sign on the existing protocol. Good morning. It is my pleasure to welcome you all to the second day of this important engagement organized the Rivers State Contributory Health Protection Program. Yesterday, we had a very productive celebration which highlighted the importance of community participations in achieving the goal of accessible and affordable health care for all residents of Rivers State. We were particularly encouraged by the remark of Our Excellency, Deputy Governor, who commended the effort of the board, management, and stakeholders in advancing this noble program. Such encouragement strengthens our collective resolve to continue working towards improved health outcomes. As we begin today's section, I encourage all participants, especially our CDC chairmen and traditional rulers, to remain active and engaged, that the knowledge gained here can be effectively taken back to our various communities. With this few remarks, it is my honor to formally welcome you all to of this program. Thank you. Long live the Federal Republic of Nigeria. Long live Rivers State.
Thank you, the chairman of the occasion, a very handsome chairman. Put your hands together for him more and more. Thank you very much. Thank you very much. We also recognize the presence of Dr. Benedict Kurubo, earlier pronounced as Kurukrubo, not Kurukrubo, it's Kurubo. You're welcome, ma. Thank you for that correction. So right on, we will be moving straight to the presentation. We'll have the first presentation. All right, thank you. I had to get some instructions from my ears. So, by our program, we are supposed to take some goodwill messages, and that we will do. A lot of persons here, dignitaries, will be giving us goodwill messages. The Christian leadership, the Muslim leadership, the Royal Majesties, we will all receive goodwill messages from civil societies and much more. However, we'll be taking the presentation on Reef Chip, which is the core reason why we are here. So immediately after the presentation from Reef Chip, then we will have the goodwill messages. Please, let's welcome Dr. Juliet Aleme that will come and take us on the presentation. Let's put our hands together for her. While she is still coming, we recognize the presence of the state NHIA leadership. The state NHIA, heavily led by Dr. Yes, heavily led by Dr. Chris Itodo. Chris Itodo, you are welcome. Please give him a seat. Dr. Juliet Aleme, this is the time.
Thank you very much, moderator. Morning. Chairman of the occasion, father of the day, all leadership of the faith, board and management of civil society organizations, POs, distinguished ladies and men, gentlemen of the press, I'd like to take a presentation The reason why we are here gathered, the stakeholders' engagement, go straight to our communities today. We have so many challenges. One of it is health. As we know, health is a fundamental human right. Everybody has rights. But many families in River State have affordable health care. They cannot afford health care, not accessible to most people. So it seems that this fundamental human rights, a lot of people are deprived of. More than 70% of households pay at the point of care. At the point when illness hits them at the facility, that is when they pay. And we know how we raise money in our environment. Sometimes relatives have to pay. Some of us that are privileged and influential in societies, we have to pay for the medical bills. We keep getting calls after calls. Sometimes churches contribute for medical bills for people. Neighbors rally together, pay medical bills for people. People borrow money. People sell fortune just to get well. Sickness, ill health is a part of living. We do not want this to continue. River State Contributory Health Protection Program is the health insurance agency of the state. We do not want people to be in trouble because of ill health, which is inevitable, is a part of life. It's not something we wish away. It's not something we say, God forbid. We have two sides of a coin, good health. So long as we are wearing this mortal flesh, we'll fall ill. And one of the ways to prepare against the unforeseen that we'll encounter in life is to prepare for that. Some people delay going to hospital because of the cost. How much am I going to pay? Even the transportation to go to that facility is not. Sometimes people get late treatments. I'm a medical doctor by profession. We've seen people that come so late. And then we have a lot of deaths. Most of them preventable. You can just imagine that by just crossing to Ghana, you have increased your life expectancy by about 10 years. While if you live in Nigeria, you are expected to die around 50-something years. That is the life expectancy. And if you cross borders, you may live longer. But we want to change that narrative. Most times, those that live in the rural communities and in the slums are the ones that are mostly affected. They are not rich, they cannot afford health care. Some of us seated there can easily be flown abroad. Or we can use the best facilities in our in River State or even within Nigeria, but some cannot afford it. River State Contributory Health Protection Program, RIFCHIP, health insurance, is here to change this narrative. We want to protect families from financial hardship. We don't want people to be scared because they are ill and they don't know where the money for their medical bills will come from. That is what RIFCHIP, that is what River State Contributory Health Protection Program stands for. We are here today to introduce you to the River State Contributory Health Protection Program. I want you to know the benefits of this program, but I'm sure with these few speeches you already know what community and each and every one of us stand to benefit. And to discuss your roles, we cannot work alone. Health is a fundamental human right. It's not only on government, everybody, community leaders, each and every one of us have roles to play if we want our communities to be healthy. We want to strengthen community ownership of healthcare. We also want to ensure that no resident meaning you live, you work in River State, you school here. No one is left behind. Everybody has access to health insurance. You can walk into a health facility whenever you're ill. You're not thinking about the medical bills. So, let me say who we are. The River State Contributory Health Protection Program is the health insurance agency of River State. That means it's a public health, a social health insurance. It was established by law in June 2020 by the barrister Ezenwonwike administration. And it became operational in the year 2024 by the Similaye Mubarak administration. I am saying this to let you know that it is not a government, one person's agency. It is a continuum. It is a legal entity that government after government will keep tending to. Our mandate, the mandate establishing RIFCHIP, is we are to provide easy access to quality and affordable healthcare services for all residents of River State through health insurance, so that we can meet the global target of attaining universal health coverage by the year 2030. That is just 4 years ahead of us. Is this mandate achievable? Do we think this is achievable? We have 4 years to achieve this. Yes, it is. If we all play our roles, we can achieve this. Our vision is to be the best social health insurance provider in Nigeria, delivering the best financial risk protection to Rivers residents. And our mission is to provide financial risk protection for all in Rivers State through accountable resource mobilization. We have to pool the resources. We have to risk and fund pooling arrangements. We have to purchase these health services and ensure that there is efficient client delivery, high quality care when it's needed at the most equitable, excellent and efficient manner. Our core values have this acronym ACQUARE. It stands for accountability, customer-centeredness, quality, integrity, and innovation, respect and responsiveness, and excellence. What we do, we ensure that every Rivers resident has access to quality health care. Quality is the word there that is qualifying the kind of health care, because we know there are different types of health care, but we want health care that is of quality. And we protect families from the financial hardship of huge medical bills. We maintain a high standard of healthcare services because we go accrediting the facilities, and those that do not meet the standard, we do not accredit. And we ensure equitable distribution of healthcare costs, so the rich pays, the poor pays, and we distribute healthcare costs equitably so that everybody benefits when they need it. We ensure that RIFCHIP is in all facilities that is close to us. Those ones in our communities, we ensure that RIFCHIP is there. And ensure there is fund for the health sector. We also harness private sector participation. We do not only use public facilities, we use private hospitals. For some of us that have preference for private hospitals. And this all will also help to improve health-seeking behavior by finding out from those that do not attend facilities. Is it that you don't fall ill? What's happening? If it's that, we are very happy. But if you fall ill, where do you go to when you get ill? So we encourage health-seeking behavior. Okay, so we have different programs in RIFCHIP. One of them is the Basic Healthcare Provision Fund. I'm not so certain, but everyone in this hall should know about Basic Healthcare Provision Fund, because it's for the vulnerable group, and it's a fund that is paid by the federal government of Nigeria. They started paying this fund a long time ago, even before we became operational. They were paying, because this is their own part and commitment to ensuring that there is health care in River State. And the state government also pays. So the Basic Healthcare Provision Fund is a fund that is paid by both the federal and the state government for vulnerable populations. We have the equity program, and this is paid for by the Rivers State government. Not just an administration, every government on them to pay equity because it's part of this, what is binding on NHIA. It's part of the requirements for every state. And states are actually assessed based on the ability to pay equity, and states are given positions based on how they implement health insurance in the states. We have the formal sector for civil servants, and then the informal sector for every other resident, be they farmers, businessmen, petty traders, housewives, whatever we are. There is a package for everyone. This way, we want to ensure that everybody is covered. Now, the Basic Healthcare Provision Fund, which I already said, what we term vulnerable: pregnant women, children under 5, persons living with disabilities, elderly persons, the poor and vulnerable households. These ones enjoy the Basic Healthcare Provision Fund. Some people say it's free medical. There's nothing that is free. Even the vaccines, we say free. We say family planning is free. There's nothing free. It means somebody is paying for it. You're not the one paying for it. So we have these ones that the federal government and the state government pays for. So once we recognize and we can know that these people are vulnerable, we enroll. And we hear some of the testimonies as we go on in this. Then we have the informal sector plan. We have Reef Care, which is just 25,000 naira for 1 good year. 1 whole year, you have access to care. We have Reef Care Basic, Reef Care Premium, and Reef Care Premium Plus. When you go to the back of the program, the differences between these different packages, benefit packages that we have will be clearer to you. And we have a barcode there that you can scan and enroll. We want that at the end of this program, all traditional rulers and everyone here would have keyed into our program. That's the only way you can be an advocate. You cannot advocate for something you're not using. I am on health insurance myself, so I can speak on this boldly. We have the tertiary students plan, and we have vulnerable group fund. So this is very important because this is one aspect of our plans that you come in. We have philanthropists, we have well-meaning Nigerians, we have well-to-do people in our communities, we have first-class chiefs, second-class chiefs, we have leaders, religious leaders, the bishops, the pastors. We have people that are well-to-do that can actually take up a plan for a number of people around them. You can say, I want to pay for 50, for 100. We already have churches that are paying for their members. We already have people that are paying for philanthropies that are paying for a certain number of people in their community. So we can all come together to make sure that we actually achieve this goal by 2030. Some communities, we are in the oil area. This River State is an oil-rich state. There are some communities in this area. I come from one of those areas, where we have community trust fund that they pay certain money. We can actually channel some of these towards enrolling some of the very vulnerable people in our communities, which we know. And then we have constituency projects that can also be covered through this means. So we can all actually come in one way or the other to ensure that no resident in River State is without health insurance. This is how the funds reach the facilities in our communities. Individuals pay their premium for those that are working and can afford it, while the federal government pays for a certain proportion of people that cannot afford it. Every state has a proportion given to them. River State has 68,874 vulnerable mapped out by the federal government, which they pay for. And then the state government has equity funds and 25% counterpart funds paid to the agency. The formal sector, organized private sector, vulnerable group where each and every one of us can come in, pay to Reef Chip, which is actually the pooling of finances. And then we pool it together, we pull them together, and then we strategically purchase from facilities that are accredited. And our community members, each and every one of us can actually go to those facilities. And when we access care, money is given to the facility, either as capitation, which is a fixed amount given to every facility ahead of those enrollees coming for each person, and then as claims for those that are accessing more complicated services, referral services, which they submit back to us. So number on your enrollment of access care, this is how much it costs, and then we reimburse them for the care given. So we fund health facilities, and they provide the necessary health services that we need. Services include antenatal care, child immunization, treatment of communicable and non-communicable diseases, drugs and consumables, even laboratory tests, even specialized care, surgeries. These are all covered under the Rivers State Contributory Health Protection Program, RIFCHIP. Currently, we have 205 accredited primary health facilities in all of the 23 local government areas in Rivers State. Currently, we also have the Rivers State Primary Health Care Management Board making efforts to make available additional 200 PHCs. So you will find out that in the near future, we have almost all the PHCs in Rivers State accredited for health insurance. We have 23 accredited secondary facilities, which is all the functional secondary facilities in the state. They are all onboarded and in RIFCHIP. And the tertiary hospital, Rivers State University Teaching Hospital, is RISUT, is also onboarded for RIFCHIP. We have 18 private facilities, and we will accredit more private facilities because as awareness grows, even the private facilities in your communities will come for accreditation. So we have wide area of many facilities, and people have choice which of them they want to use. So we are doing this so that we'll make sure that at every place where we are located, there is a facility that is accredited that we can easily test care when the need arises. So how the system works? How the system works, once someone is enrolled, they visit the facility. It could be a primary health care, it could be a general hospital, it could also be a private hospital, depending on their choice. But for the basic health care provision fund that is paid by the federal government, the entry point is through the primary health facilities. For those that are in individual premium, that are paying for themselves, they can actually choose what facility is care. Then patients that cannot be taken care of at the primary health facility or even a private facility are referred to higher levels, maybe the tertiary facilities. And then the bill still comes to us at the end of the day, and we pay up all the bills. So this reduces overcrowding, so you don't go to a place and they say, no bed space. It's very common, no bed space. People that are critically ill, one hospital to the other, looking for bed space. I mean, someone is critically ill, the illness doesn't wait for you to find a good hospital. The person up on the way. These are preventable deaths. These are very, very bad experiences that we don't want to have. It saves cost and it saves time. So far, in the 2 years that we have been in operation, what have we been able to do? We've been able to onboard 205 primary health care centers across the 23 LGAs. There is no LGA that does not have a RIFCHIP accredited facility. We've been able to accredit all the secondary health care facilities in the state. We have accredited the only state-owned tertiary hospital, that is RISUT. We've accredited and onboarded 18 private facilities with plans to accredit more. We have enrolled over 144,000 residents in Rivers State into the RIFCHIP, into the various plans that we have. I have said earlier, the Basic Care Provision Fund, Equity Fund, the RIF Care plans. We have people in these categories. We disburse funds promptly and regularly to the PHCs in the state, and we also give for capitation, and we also fund secondary, tertiary, and private facilities for claims. We've recorded over 100,000 services, over 14,000 ANC visits, over 3,000 normal deliveries, over 500 cesarean sections. Sometimes I wonder what would have happened to these women that had cesarean sections in our program if they were not covered. Is it possible that some of them would have been the deaths that we hear of when women? Nigeria has a very high maternal mortality, death of women. In short, when you live in Nigeria, your risk of dying during delivery increases just by living in Nigeria. Something that makes news that a pregnant woman dies in developed climes, like the news carries it like something has happened. Here, they die by the side, they just hit one bus, put them out, the man marries another, as if life does not matter. It shouldn't be. A woman should not die because she's trying to bring another life. So we have also had 400 other surgeries, including hernia operations, appendix, fibroid, cataract extractions, just name it. We've had all these surgeries. The testimonies will bear witness for themselves. For all this that we're able to achieve. This is the enrollment by LGA, so you can see how your LGA is faring in health insurance. Obiakpo has the highest enrollment numbers and Port Harcourt LGAs. It's not because there are more, because we know that the LGAs do not have the same population. So when we do the percentage per population, we know how much each LGA is actually used. Because I'm from another LGA, West, but I'm living in Obiakpo. So we all count to the Obiakpo LGA population. But it doesn't mean that this is just absolute. When we get the relative cost, we know how each LGA has fared. But this is just the bar chart showing the absolute number of enrollees in each of the LGAs in Rivers State. The list we have there is Bonny LGA, followed by Opobo Nkoro. Then Akukutoru, Omuma, and Eleme. These are the list, 5 LGAs with the least enrollments. I'm sure some of the traditional rulers are from these LGAs. We need to work together so that the numbers can come up. Okay, what is your role as a traditional ruler? What is the role in Reef Chip? Why did we call gathering? What is your role? Pictures speak for themselves because we can actually address the community on this. We are influencers in the community. We are respected elders in our community. We are voices in our communities. Our voice alone, people listen to us. So we can actually address the community. We can have, we have WDC, CDC. If you say there's insurance, if the community takes it up and tells these people, they will buy into it. So the CDCs in our communities, they have a role in mobilizing, actually getting people to enroll in Reef Chip. They can create awareness in the communities about the health insurance. They can actually engage residents to use the PHCs that we have in our communities, in our wards. They can help us to identify the vulnerable populations. Yes, we have a social register, but you live in the community. People's status change. Social register of 5 years ago will not tell us what is happening. Some people that were rich 5 years ago are now vulnerable. Some that were vulnerable 5 years ago are now, they can now do well. So you live there, you know the people that are actually vulnerable. You can help us with identifying these households. You can also mobilize community members to enroll into the program and also give us feedback. That facility in your community, how is it doing? Are the health workers coming to work? Are they available? Are they early? Are they responsive? When they see patients, do they attend to them? Or they just, most times people feel the public facilities aren't doing well. Are they actually doing what they should do? Are they responding the way they should respond? If it's beyond them, do they refer promptly? We need feedback. We need to work together. Because the CDC leadership actually strengthens community participation. You can't go into a community and do anything if the CDC leadership is not carried along. to ensure that there is buy-in from the community. Even the ward development committees, they are even attached to the primary health centers because we run a ward health system, meaning that in every ward there must be a primary health facility. That is the kind of health system that Nigeria runs, a ward health system. That primary health facility in your ward has a ward development committee chairman who is a signatory to the Basic Healthcare Provision Fund account. So he knows when the money comes. It's part and parcel of the management of that facility. So we are also now informed so that we can hold our WDC chairman account for what happens in the PHCs. They should support community engagement. They should support community engagement with PHCs, so the quality of services, promote utilization of the PHC, and then support implementation of Basic Healthcare Provision Fund. Provide feedback. We need feedback. We may be saying all these things. Some of you may be saying, that's the program is good, though, but the air facility is a problem. We want you to give us feedback. Can you bring it up, please? What's the role of traditional rulers? They are custodians of our tradition, of the welfare of the people. You're very, very, very important because you are at the helm of affairs in that jurisdiction, your locality. You are the one that decides what happens in every other area, and even in health. I want you to also be there for us. And mobilize communities to support us, encourage families to seek health care, promote maternal and child health services. Because we said Nigeria has a very high maternal mortality. Women die a lot, and even infants, children, die a lot before they are 5 years. A lot of them die. We can support to identify vulnerable population. We can provide leadership and oversight for community health initiatives. So maybe in our meetings, when we have meetings with the CDCs, we can bring up issues. We can make it a point in the agenda. We can decide together, what do we do? Do we even own up, and do we buy for some people that are vulnerable? What do we use this money that's coming to the community to do? Can we invest some in health? This is just showing the different CBOs, CSOs, clergy, everyone advocating for health care. We all need to be healthy to actually go about our businesses. The religious leaders, they have strong influence. Like they say, Papa said, Papa said. We believe our Papa so much. If they say jump across the fence, we will jump because we have faith that before we get there, the fence will crumble. So we want you to lend your voice to the congregation. For those that are Christians, for those that are Muslims, you listen to the imam. We want you to lend your voice. If you tell your congregation, please have health insurance, I'm sure that they will listen. The way they have been listening in other things, when they say, sow seed, you sow. They say, get health insurance, also get health insurance. But when they say sow seed, go and sow because you believe it. We believe our pastors, we believe the imams. Please, we want you to lend your voice. Let our congregation be healthy. Because if they are not healthy, I assure you, part of the offering that is given, you use it to be supporting people that are sick. You use it to pay hospital bills. Because always, from time to time, they will keep calling for offering for the needy, offering for the needy, offering for the sick. This brother is sick. We can also speak to them to take up benefit package, or if we are well to do, we recognize the most vulnerable in the churches and pay for them. We can also support community mobilization for cheap activities, provide care for vulnerable members of our churches and our mosques, support health education and prevention messages. We can actually say these things. There are health messages in the Bible, there are health messages. We have to be healthy. In as much as we believe in divine healing, God also heals through different ways. So we should also help ourselves because wisdom is profitable to that. So faith leaders should help us preach this message so that their congregation can be healthy. The community-based organizations, you are at the grassroots. You are the grassroots. You can talk to your people. You know what their issues are. You can advocate for us. You can help to strengthen this campaign. In your programs, please, just put in reef chip, health insurance, please. And also assist in identifying the vulnerable, provide community feedback and advocacies. You know the way to do people that support your programs. You can also take up a program to cover health care for the people in the communities. Please lend your voices to this cry for universal health coverage 2030. We want River State to be the best, to come top on the list. Currently, we are like 50. We're not doing so well. We're 14, okay. So we have the CBOs, CSOs. Please advocacy, add reef chip. We are aware that donor funding is dwindling. A lot of people that used to support dwindling. Let us now think for ways that will help us better and advocate for people to have insurance. What do we want to do next? After this gathering and after this sensitization, we are going into the 23 LGAs to campaign for reef chip. So when we come to your facilities, we want to work with you. It is not strange. Do not ask who are those people. You know, oh, the program I went for, they are here now to enroll. We want to enroll people massively in the communities. So as a way, we want to improve services at the PHCs, the secondary and the private facilities. Work with community leaders. You will be notified that we are coming. So you can help us get those vulnerable people and we assess. If you need to pull the funds together, you decide ahead how many you are paying for. If you want to give us the list, it's okay. If you have people in your mind, you want to give us the list. When we come to your community, give us the list, pay for them, and we'll enroll. But just be sensitized that we are coming to all 23 LGAs in River State to enroll people. We have even got NIN machines because to benefit from the federal and the federal government, the Basic Health Care Provision Fund, you need to know that you're a Nigerian. So for that one, NIN is the only identifier. That is what singles you out as a Nigerian. So we have even bought these machines because a lot of people in the villages do not have access to NIN. So when we come, we are coming with the NIN machine so that for all those that you have recognized as vulnerable, all those that the community want to pay for, and even those that can pay for themselves, we have to let them know ahead to keep their 25,000 naira or whatever plan that they want to available so that as we come, we enroll, everybody can get. Maybe we should do a study and see which community enrolls most people. All right, so together we can actually work build a healthier River State. So we have already spoken about all this. Help us to inform, enroll yourself and your family as an advocate. Inform your communities to enroll. Provide feedback on how the program is running in your place. Our numbers are open. We run a 24/7 call center. We are very responsive. And we have to advocate to organizations, well-meaning individuals in the society, to pay for vulnerable populations in your communities. You can actually get them ready so that when we come around for this campaign, shortly after this engagement, your community will be ready. We don't have to say, come today, come tomorrow. We are informing you ahead of time. We are coming to your communities to enroll. This is just the community sensitizing people about reef chip. Number there is actually true if that get to us. We want to thank you very much. In conclusion, we want to say that reef chip is a key driver in advancing universal health coverage. And we want to achieve these goals. We can only achieve it through collaboration. Now we are all aware that health is a fundamental human right. And we all have a part to play to make our people healthy. So we want communities, governments, religious leaders, CBOs, CSOs, everyone to put hands on deck so that we can achieve our goal come 2030, even beyond. Because together we can improve awareness, we can strengthen healthcare service, promote health-seeking behavior, reduce maternal mortality, even help to improve and increase our lifespan as people living in this part of the world. You can build healthier communities for all River State to live in. You can reduce the financial burden that people bear when they go to hospitals for care. It's not only hospitals, even the pharmacies that you go to, drugs are very expensive. How much is anti-malaria? Drugs are very expensive, even without going to the hospitals. This is just the flyer we have at the back of flyer. Thank you very much. Some pictures of activities in different places. Thank you very much.
Please, can we put our hands together to Dr. Juliet Aleme? Dr. Juliet Aleme is one of the management staff of River State Contributory Health Protection Program. In the PROS department, he is saddled with that responsibility, planning, research, and statistics. That is why she was railing out those figures without any difficulties. Once again, can we please appreciate Dr. Juliet Aleme? Thank you, Dr. Juliet Aleme. That is what RIFCHIP is all about. That is the vision why we are gathered here. Please quickly, we'll be moving on. Sorry, a little tweaking in our program. If you're looking at the program, we are supposed to have goodwill message, then we move to the presentation. So we will also move upward. We'll be moving upward now. We'll take a few testimonies because of our time. We had numerous of persons that have had an encounter with River State Contributory Health Protection Program, alias RIFCHIP. Please, can we shout RIFCHIP? Say it again. Say it again. Yes, so that's the name. That's the abbreviation, RIFCHIP. So we will be taking a few of testimonies. This is about 2 years1IFCHIP has been in operation, 2 years down the line, and a lot of impact. From the data that we just saw, we saw that over 144,000. So over 144,000 persons have had an encounter in RIFCHIP. And so a lot of persons are here to testify, but we will just take very few on before we now go into maybe 2, 3, or 4. We'll go to goodwill message. I understand a lot of dignitaries will be leaving here. Now we will have an interaction sections immediately after the goodwill message. We'll go into interaction sections where you will ask all the questions you need to ask and contributions, how the way forward. We are going to have a robust interaction sections. So don't worry yourself. Jot down your questions. Thank you very much. Please, can we try to minimize the noise behind, please? If there is no seat down, there is an overflow up, please. A lot of persons are already seated up, please. Ushers, direct them up for an overflow up. Thank you very much. So in the line of testimonies, we will be welcoming the following person, Mr. Akpani Glory. Is it Mr. or Mrs.? Akpani Glory is one of the testifiers. Please, where are you? Akpani Glory, please come out. Yes, come out. Josiah, please come and give her the microphone. Okay, please just stay somewhere. Let's also have Faith George. Faith George. Then Chibuzo or 4. Let's stop with these 3. Then maybe thereafter we can continue. Yes, Akpani Glory, please.
Good morning, everyone. I'm so honored standing here before you as a testimonial of the RIFCHIP. This is one of the testimony. I had a free and good care, and it was so easy. I want to say thank you to the government and everyone. Thank you.
Please, we didn't hear you. Say, what happened to you?
I had a free
delivery?
Yes.
Was it CS or normal delivery?
A CS.
You want to call it as CS? That she did CS. How much did you pay?
I never paid anything.
How much did you pay?
Nothing.
She did not pay anything. Why? Because you register with
the Reef Chiefs.
because you register with Reef Chief. That's what we are trying to talk about. That's what we are talking about. Thank you very much. Please, can we put our hands together for her? Put our hands together to Reef Chief. Yes. Please, next person, can you come? Why are the young men now? You will remove the young men. Only ladies are coming. Okay, please. Please go ahead.
Good morning, everyone. I went to my health care center at Bundu. At Bundu, I was having a redness of the right side of my eyes. It was this red that after the doctor checked on me, she said, no, I have to refer you. So she referred me to teaching hospital along Garrison Road. And I want to tell you, I really benefited. I didn't spend a dime, no money was collected from my hands. They checked me, they gave me eye drop, they gave me some drugs. I just want to say thank you to Reef Chief. Thank you. This program is really good. And I say, may the good Lord bless the source from where it is coming from in Jesus' name. And may our government continue. And may God give them the grace to do this great work in Jesus' name.
Praise the Lord. Good morning, everybody, Your Royal Highnesses, and all the men of God, and everybody here. Good morning, all. Actually, the Bible made it clear to us in the book of Proverbs, chapter 29, verse 2. It said, when the righteous is in power, the people rejoices. I want to tell everybody that I'm a beneficiary to this ritual. Last year, I had a terrible ailment. I was diagnosed of kidney, heart problem, liver, a lot of things. And there was no money. And a sister in my church collected my NIN. And they registered me. And when I went to the hospital, they told me that I'm registered. And before you know it, the doctors there referred me to BMH. And I went there. I spent 2 whole months. And everything was done without paying a dime. I want to appreciate this government. I want to tell you people, this government, there's something Bible made it clear to us in the book of Isaiah chapter 54, verse 14. It said, thou shalt be established in righteousness, and you shall be far from oppression. Anything that will oppress this government, heaven will steal against it in the name of Jesus Christ. No power, no kingdom will stand against our governor. Governor, carry the go. We are by your side. You will reign and reign in Jesus' name. Thank you so much.
Thank you, thank you, thank you, thank you. That is what Reef Chief represents. That you will walk to the facility without money in your pocket and you are taken care of. Please, is there any other person you have benefited from the Reef Chief program in the hall there? Is there anybody there? Okay, please, don't worry. Don't worry for those that are up because of our time. We'll be moving to the goodwill messages. Then we'll continue. We'll move to goodwill message. Please, I understand that the Alhaji Ambassador Nasir, I almost call Erufai, because once you call Nasir, the next is Erufai. All right. Alhaji Ambassador Nasir, River State Islamic leader, the Vice President General, River State Council for Islamic Affairs, and Chairman, Association of South Muslim Ummah of Nigeria. Sir, please can you stand for recognition? Please bring him to the front. Bring him to the front. Put your hands together for him. Bring him to the front. Let him sit with our own Eze. Please bring him to the front. Keep clapping for him. Alaji Ambassador. You are welcome, sir. You are welcome. Thank you very much, sir. He actually has a resemblance with Erofai. Thank you, sir. You're welcome, sir. So quickly, we'll be going to the goodwill message. We'll take some goodwill messages from what we have seen so far about Reef Chip and lots more that is to come. And from the presentation, we'll be welcome. First on that list, we'll be welcome our dear Eze, who has been adopted, the royal father of our dear executive secretary. His Royal Majesty Eze Leslie Eke, the Eze Baka, Eze Ohaivo III of Evo Kingdom, President, Association of Christian Traditional Rulers of Nigeria. Welcome, sir.
Praise the Lord. Governor of Rivers State, Deputy Governor, Chairman of Board, Chike, Chairman of Occasion, and the South South Monarch Chairman. Moha, Majesty Agent Awusie, representative of Chairman of Council, Rivers State Council of Traditional Rulers, ably represented by the King of Omuma, Barrister Yekachi Amon, head of Muslim community in State, because he was just nice shortly. That in that space of time, I've forgotten the Dr. Felix Otubaribo. Yeah, you say what? You say what? Alhaji Owo. He's my brother, but I can't pronounce it. Alhaji Owo. Yes, you're welcome, sir. Dr. Felix Otubaribo Ezu Bata. Chairman of CAN, the head of Niger Delta Bishop Conference, Archbishop Ediwe. So many of you here. I appreciate all of you. The Secretary to the Supreme Council of Ikure Government Rulers, Ezugo, that is here. All welcome in Jesus' name. When there is a thing like this one, what I look for, sure, you should look for that too. How the thing go fit profit me? How does this thing profit me? How do I, if this thing no get here, make one leave am? But we see from what was said, this program of government continued, and for the most part initiated by the governor, a people feeling person, feeling for the people of Rivers State. The beauty of this program is that you don't have to, I'm not sure, I didn't hear them use the word indigene. Every resident of Rivers State is eligible for this program. You know good so? So I listened to the doctor presented this so passionately, and she was talking about this program is affordable. 25,000 to get 600,000 surgery, 1 million plus, or any kind of illness, just 25 for a year, and you're taken care of. So it's a very good program. It's affordable. The coverage is limitless. It's not limited. I don't know whether you have experience of the regular insurance that we know about. Before anything, I remember. That's why I don't go by those insurance. When you don't get accident, they will not remember you. They will begin to give you all kinds of rules and so on. And if you're in the hospital for emergency, you first go inform them. Only God will take care, because maybe by the time they come back to do anything for you, you don't pay me. But this program is accessible. As you register, you're going to the hospital, you have the card. Show them, and anything that is possible for you, they will do it. All right? And one of the things they want to do, the lack of awareness is what they are doing now. To make us to be aware. But for us here, professional rulers here seated, religious leaders here seated, there are two things expected of us in this program. One of them is that you yourself, you have to register yourself. You need it. You personally. There's no gainsaying. You need this program. As the woman just said, both of us are going to be registered today. I don't know whether you can pay for me. As the woman is sponsoring me. Yes. And then the second role we have is for us to tell our people, our trusted figures in the community, so we are able to bridge these gaps. People that don't know, encourage them. We are spiritual leaders in our communities, in our churches, in our mosques. We have this role to play. Apart from you registering yourself, you also got people around you and help them to assess this God-given miracle, I should call it. So we are significant. This program is equally significant. We are partners with government. The leaders in the society, so we're partners with government. We should promote awareness. We should influence the attitude and behaviors of our people regarding healthcare. They say if you have health, you have life. Abi? So we should collaborate. Sponsor people. But that's a third role we have to play. Sponsor the one they call vulnerable persons that cannot pay. Sponsor them. I won't tell you how many I'm sponsoring. But sponsor them. Be encouraged to sponsor these people. So, if the ES, congratulations. Thank you for your efforts. Board members, God bless you all. We love you. We like what the governor is doing in Rivers State. God bless you all.
Thank you, sir. Please keep clapping for His Royal Majesty. Keep clapping for His Royal Majesty. His Royal Majesty has been very supportive, and that is why our ES has quickly adopted him as a father. And since you are the father to our ES, you are father to all of us. So thank you, sir. But sir, we didn't hear from you if you've accepted that adoption. Just 1 minute, sir, because it was an open one.
And when you fill the form, for you.
Thank you, sir. Thank you. That was on a lighter note. Thank you very much. So we will be proceeding on the still goodwill message. So we will call on our very Reverend His Royal Majesty, the wise King, no any other person than our Father Sergeant I will say. Please, can we put our hands together for him? Did I hear your no? Oh, the Olo. Keep clapping for him while he comes up. Keep clapping for him. You're welcome, sir. It's a privilege to see you, sir.
Thank you very much. Royal Father of the Day. Acknowledge want to pay my special tribute ES of this. When it comes to health, I will hear less than 2 minutes. My first appeal, federal government. Because of poverty level, had more money. This program. I will also appreciate the effort of the state government and at the same time Oliver Twist by asking them to add more money also. Number 3, I will also wish contributions by the poor people should be less than what it is now, should be reduced. You may not understand what I'm saying now, but if you look at the statistics the lady gave, there's a relationship between poverty and the number of people registered at the rural area. Check the figures, Obiakpo, the most elitist local government in Rivers State, followed by Falga. And go down to Pobo and Koro, Omoma. Now imagine, I said, a direct relationship between income, affordability, and the registration, how it has affected it. Doctor that did the presentation, special job there. That's the height of all the information, registration of the local government. Every other thing is grammar. This program is for people, human beings. The effort of your organization cannot be overemphasized. You've done very well within 2 years. In UK, I summarize, where National Health Service have been on, they are still improving. They are still expanding. They are still putting more people into the cage of those who will benefit. 2 years, what you have done is commendable. You should do more. Your publicity section should expand their scope, please, and reach out to rural communities more now. I was pleased to hear from you that from now, we're going to concentrate more on the campaign in the local government area. It's the right step in the right direction. We will do our best. As traditional rulers, we'll take the message home. Make sure the CDCs and all the various organizations, bodies are told what to do. where we can as individuals, we are going to help to make sure this program succeeds. Thank you very much, and God bless all of us.
Thank you. That's awesome. Your Majesty. But where are the photographers? Please snap me and where are they? Thank you very much. Thank you, sir. Thank you. Thank you. We've been hearing this name, Sergeant Awuse, and since and here it's a privilege. Thank you so much, sir, for coming. We appreciate you. We will move on the goodwill message. Moving on the goodwill message, we will be calling the chairman of the traditional. Thank you, Your Majesty. So still on the goodwill messages, we will be, let's recognize, before we call the next, let's recognize Chief Nabil Salah. This name sounds like the Salah, that generator. That is a generator. Okay, Salah, that generator. Welcome, sir. I've read about you being the president of FESIMA, isn't it? Ladies and gentlemen, put hands together as we recognize the former president of FESIMA, Chief Nabil Salah. If you have a soundproof, then you will understand. Thank you very much. I'm privileged to have one. That's why I remember that. Let's quickly welcome His Royal Majesty King Barrister Onyekachi Amewu, DSSR Eze Omoma of Ancient Omoma Kingdom, representing the chairman of the Traditional Council Rulers of Rivers State. Put your hands together as he comes in for his goodwill message.
Praise the living God. His Excellency, Deputy Governor of Rivers State, permit me to stand on the existing protocol. Wealth is health, and health is wealth. Health is also life. This establishment came in force 2024 by the governor of Rivers State. And since then, there are tremendous improvement and achievement. 445 lives touched. You can witness the testimony here. Employment of 2,000 health workers. Rehabilitation of 153 health centers. Upgrading of specialist facilities to strengthen safe delivery in Rivers State. Ensuring that out-of-pocket expensive is used. Well, it's a collaboration between the state government and the people of Rivers State. All hands should be on deck for us to achieve this noble plan by His Excellency. Chairman, Rivers State Council of Traditional Rulers, asked me to tell this organization that the Council of Traditional Rulers are well involved in this program. As royal fathers, we will go to our various domains to ensure that this message is trickled down to our citizens. After 40 years, there is something spectacular happening here. There's a Baka Baka. His father and my late father are health officers. They worked in Port Health before the father left as a deputy governor. My own late father retired as the chief health superintendent of Old River State. So they have gone. We are here planning how River State Health Sector will come to light. We thank God for that. Anything we are doing here without synergy will not work. There should be collective responsibility between the CDC, the youth leader, elders, Christians, community leaders. All hands should be on deck for us to achieve this noble goal. In the name of God the Father, God the Son, and God the Holy Spirit.
Thank you, sir. Thank you very much. Please, let's continue to encourage him. Clap for him. Clap for him. Thank you very much. So we are still moving. There are quite a number of persons for the goodwill message. Let's now also move into the Islamic region, and we will welcome the head, our very father, Nasiru, to give us a goodwill message on behalf of the Muslim community. Please clap for him. Thank you, sir.
Auzubillahi minash shaitanir rajim. Bismillah. Permit me to greet all of us, established protocol. Divine greeting. Assalamu alaikum rahmatullahi wa barakatuhu. That is to say, may the blessings and peace of Allah be on us all. On behalf of the River State Council for Islamic Affairs and the entire Muslim Ummah community of River State, I humbly stand before you, convey our message, goodwill, not only the agency, but to their state. Here. I want to say that when it comes to health, the Muslim Ummah, I want to say that this agency would not have been entrusted into better hands than Dr. Vetti's hands. The reason, before she was appointed to this agency, we of the council, particularly myself, have actively worked together with Primary Health Care Management Board. We know we are used to our passion. Used to it. I wasn't surprised. Got into I also know that nothing will hold back this agency as long as Betty is driving seat. We have come to establish about 3 of them. I call them the 3 musketeers in the health sector of the state. She being one. Another one is an unassuming but very hardworking sister of the state, daughter of the state. Dr. Anna Babo. She's there, she's state health educator. We also have Dr. Joy Walker. These 3, I call them the musketeers. They work like horses, make sure that they succeed. We have been involved in immunization programs, maternal and newborn board. So we are not surprised at the achievement so far recorded by Dr. Betty Agala. We just pray Allah to give her the courage, strength to do more. Why are we passionate about health? Since she sent her letter of invitation to me, every day I went for prayer, I read that letter to my mama. I've been reading this letter to them, urging them to go for registration. It doesn't seem to attract any attention. Then last Friday, I did something new. I walked up to the pulpit after the prayers. I said, I want everybody to be very truthful. I said, if you are sick, go to hospital 1, they treat you and they say you pay 10,000, but you don't have 10,000 to pay. You leave. You go to hospital B, and they say, the money is 10,000. But wait, somebody has paid 8,500 for it. Pay only 1,500. You say, where the hospital dey? So I asked them, which of these 2 hospitals would you like to go? And the second one now, where the hospital dey? They asked who paid the 8,500. See, this is the health insurance scheme telling you people. Government and donors have sponsored this program. They paid part of that 10,000 so that you can only pay 1,500. And you get your services free, almost free. That was when deluge of questions started coming in. People who were even about to walk out came back again. They wanted to hear more about this. I told them, after the meeting of Wednesday, 11th, back with me. For now, prepare your minds to go and register. Register yourself, register your family members if you can, or start from somewhere. See, that has brought down to me the need for clear information. If they don't understand what you are talking about, they are not likely to be aligned with the program. But because of the way I graphically explained it to them, it was very clear now that this program will be to their own benefit. And that is what has been stated here, that we should see this program as benefit to us. So that being the case, I'm sure when I go back now and tell them what I have learned from here, there will be that enthusiasm. Once the enthusiasm is set off, we can be sure that there will be a deluge of deliberation. For the simple reason that the hadith of the Holy Prophet stated, they quoted Prophet David and said, Prophet David said that good health is the crown, the head of the person, healthy person. Only the sick can see. It was a very profound comment made by Prophet David. Good health. The person enjoying the good health, that is a crown. He does not know that he has a crown on his head. But it is the person lying low who is sick, very sick, that recognizes the value of the good health. That's exactly what we have to do. And to round it, the Quran said, do everything you can to save a life. Do everything you can to save a life. It didn't say do everything you can to save a Muslim life or to save a Nigerian life or Ghanaian life. Everything you can to save a life. And the one who saves a soul, it's like he has saved the entire mankind. And the one who destroys a soul, it's as if he has destroyed the entire mankind. And we are told by experts that there are about 12 billion people on planet Earth. So if you save a life, it is like you have saved 12 billion people. Likewise, if you kill one life, it's like you kill 12 billion people. You can now know the value of this insurance scheme. 144 persons multiply, you see the number of people the agency has saved. So we are with you. We are going to be with Virtual Gala the way we'll be with you and continue to make progress and ensure that our people access this scheme through registration. Thank you very much for giving us this opportunity to be part of this program and to talk to you. Assalamu alaikum wa rahmatullahi wa barakatuhu.
Thank you very much. Thank you very much. You're welcome, sir. Thank you very much. Yes. All right, so still on the goodwill. So, still on the goodwill message, we will move now to the Christian community and to speak, to give us a goodwill message on behalf of the Christian community. We want to welcome His Eminence, Archbishop Professor Julius Edewi, JP, President General, Niger Delta Indigenous Bishops and Ministers Forum. Let's put our hands together for him. You are welcome, sir. Welcome, Prof.
All right, my own is very simple. Let me stand on the existing floor. I want to thank Izzy Baka for inviting me to this gathering today. Actually, when I received, I came to my mom. How much are they going to share for kind of later to in the secretary to, and I'm in the deputy. I say, how much? I look at that, it's not going to be okay, it's something reasonable. So nextly, as I came in, and I sat down, listening to the doctor, listening to what they are saying, I said, how? It is more than sharing money. Honestly. And because of that, as a president of Niger Delta Indigenous Bishop, which I'm almost here with almost 20 persons, which we have more than 300 persons in Rivers State. I have decided that today, we need to register 100 persons in Rivers State. We will register to this body. Honestly, this is one of the best things that the governor have decided to do in Rivers State that is best. And I want to use it to thank the governor and the deputy governor for this good thing. No wonder, let me just say this, Your Majesty. Actually, when the governor was away for almost 6 months, cry and pray that God should bring this governor back to Rivers State. And listen, God answer our prayer. I'm happy that the governor is back to Rivers State. And this good work that they have started doing here, honestly, not only that, please, the woman that speak, come on for them and see the woman face. Mama, I want to tell you that the Niger Delta Bishop will be a partnership with you, with what you are doing in this place. We have a conference coming up in Rivers State, and we are going to invite you to talk to almost 2,000 people, 5,000 people. In a sense, that's life. And when the daughter was talking, it got on me, bishop that lost his wife. Just to run away, the daughter said that you drop 300,000. Just to find 300,000 before all of us, they run up and down. The woman have already given. He paid me for such a thing. And because of that, with the bishop, with the ministers, we will go out this good message to everybody. May the Lord bless all of you. In Jesus Christ's name I pray.
Thank you very much, Bishop. Thank you, Prof. I will also have the honor to take a picture with you, Bishop. Where are the photographers? Run now. Thank you very much, Bishop. Thank you. I will accompany my ES to come for that presentation. Yes. Thank you, Bishop. Please, still in that line, let's quickly welcome. To add to that, he whispered to me that there is something very important he wants to add up to what His Eminence have said while they were discussing. Please, let's join our hands as we welcome Right Reverend Bright Eze, the Bishop of Okrika Diocese of Anglican Church. Please put your hands together for him. He has a very important message to pass across to us. Bishop, you are welcome. Thank you, Bishop.
Thank you very much. Let me stand on the already established protocol. I'm not the Bishop of Okrika Anglican. I am of the First African Church Mission, Okrika Diocese. The Right Reverend is a Bright at ATC from Onelga. Praise the Lord. So let me just be very brief as I give thanks to the board chairman as well as Dr. Betty Agala, the executive secretary of the mission. In Bethany, something happened. A certain woman poured a very costly oil at the feet of Jesus Christ. And people begin to tell him, why must you waste such money? And there are other poor persons that he will have patronized. But Jesus Christ said, what this woman did will be for a memorial. And it will be for remembrance. I want to thank the executive governor. You have done something that will be memorable in the life of humanity. And the God of heaven will sustain you in the name of Jesus Christ. So, this program, very, very good. I want to assure the secretary that in my next Diocesan Council meeting, the first thing in my own address will be all the ministers should register for this chief.
Wow. Can you clap for that? Please, a round of applause to that.
And again, the most Reverend Dr. Kala Dokubo is the camp chairman of Rivers State. And Bishop, the Right Reverend Odo, is also the CCN chairman, that is the Christian Council of Nigeria, where I belong. I will make sure that on Tuesday we are having Christian Council of Nigeria meeting. I will make sure that this information will go to that body. But starting from the ministers to every other members of our association. Thank you very much, and may the Lord bless you all in Jesus' name.
Thank you so much. Thank you, sir. What a commitment. I can imagine inside the belly of our ears now butterfly now. Now butterfly. We are happy. Even the management team, we are happy. Thank you very much for all the commitment. Reef chip is going higher. Okay, so please, we want to also hear from the business community. We'll hear from the business community. If you have an office, if you have staff, including your domestic staff, they are supposed to be enrolled to Reef Chip. If you have a staff, 20 of them, 3 of them, make sure every one of them is enrolled. And I think it will better, we'll hear it better from a specialist in the business community. To take us on that goodwill, we will be calling the M. Salah, the former FESIMA president, to please come and give us a goodwill message and from the perspective of the business community. Please put your hands together for him. I was just being informed that you are a chief, sir. Is that correct?
Good afternoon. Let me stand and hold. Every morning when we wake up, thank God for good health. Well, I encourage the organized private sector in River State, of Commerce, sector ASI, ESMA, and NECA to partner with Reef Chip. Because if the employees are not in good health, they can't deliver. Madam Vetti, Dr. Vetti, they are doing very well. You need to communicate the organized private sector, attend their own AGM. Every organization, Chamber of Commerce, even if they have health insurance for their own employee, which is compulsory, at least is every company support the community where they are operating. With few health care, help the society. Once again, congratulations. Good well. You are doing very well. Thank you.
Thank you very much. Let's put our hands together. Brief and precise. Thank you very much, M. Salah. Thank you very much. If you need soundproof generator, please contact me. I can always reach out to him. Yes, I'll be the middleman. Thank you. Please, we will still going further to take goodwill messages. We'll also enter into the health sector. Can we have Dr. Joy Weyaka representing the director, the ES, representing the ES Primary Healthcare Management Board. Okay, please, can we welcome Dr. Diane Dabo? Dr. Diane Dabo. Please, let's put our hands together for her. Dr. Diane Dabo. The state Okay, Babo. Dr. Diane Babo, please, pardon me. Please put your hands together for her as she comes up to give us a goodwill message. Red Cross Society, please, you are the next.
Good afternoon, everyone. Please permit me to stand on the already established protocol for this occasion. Very glad to see my dear father and friend. We started a journey together, and then so we are seeing where we are flourishing to. Thank you very much, sir. I was not directed by my executive secretary or my director to stand here, but I'm very, very overwhelmed by the recognition and the opportunity to speak on behalf of my principal, the executive secretary of the River State Primary Healthcare Management Board, to say that we as River State Primary Healthcare Management Board, where like we have seen over 200 of the facilities are where the beneficiaries of RIP chip best for their care before they are referred to any other secondary or tertiary institution. We say we work with you. Our facilities are open, they are ready to deliver every kind of care at the primary level, and then we ensure that there's a good communication between the primary and second level of care by ensuring we do a good referral and follow-up of all our clients. We are very happy for the testimonies we have received here about the benefit of the program, and I'm glad for this community engagement. My specialty at the board is this kind of town hall meetings where we communicate the knowledge of the basic and the nitty-gritty of what we are doing, So that once we appreciate it, we can run with it, we can own it, we can drive it. And Dr. Vetty has been my mentor, my senior colleague, my sister, my friend. We have been in this journey for quite some time when it comes to health interventions. And I know that this crowd I'm seeing here will become champions and advocates for optimal health care that will not show on our pockets adversely. That is what Reef Chip is really all about. So we'll drive the mission together, we'll drive the vision together, and on behalf of my ES, we commit to doing the best we can at Samari Healthcare Board so that Reef Chip continues to grow and expand. I greeted that when I came in here. I said, we are expanding. So this is growth, and we hope to grow and mature into full fruition to see that the governor's dream to give all Rivers residents, not indigents, all Rivers residents, the quality of care that they actually desire and deserve. Because you know that if you have a health challenge, despite the money that you have, you don't have good health, all your money will count for nothing. So we're here to partner with you to give all Rivers indigents, all Rivers residents, all Rivers people, and all that are with us in Rivers states, the good quality of health that they actually do deserve. Thank you very much.
Thank you, madam. Thank you so much for that short and brief. The state health educator of Rivers State, Dr. Babo, thank you so much. We also recognize while the goodwill message was going on, His Royal Highness Ambassador Eze Dr. Onoka Okoromini JP walked in. Please, we recognize you. We salute you. The Vice Chairman of the Supreme Council of Ikwere Government Recognized Traditional Rulers. You're welcome, sir. Thank you, sir. Still on the goodwill, let's welcome our very own Dr. Ishmael Jaja, representing the Chief Medical Director of Hospital Management Board for the goodwill message. He has to speak because it's the hospital we are using before they will close the doors of the hospital. Welcome, sir. Welcome, my boss. Please put your hands together for him.
Please permit me to stand on already established protocol. On behalf of the Chief Medical Director, Dr. Bright Obunda, who is unavoidably absent, and here this morning to pledge the commitment of the Secondary Health Prize. Dr. Vetty Agala, the Executive Secretary, is our product. So she's doing all she can to make sure that the secondary health care is well positioned to run this program. I'm here also to our capacity as a board member. You can see how the secondary health care is important, and we are going to make sure that all that we desire from this program is achieved. The arrangements in place to make sure that you don't go there and come out complaining. So be rest assured, once you get registered, referral is made to the secondary health care, you'll be properly taken care of. Thank you, and God bless.
Thank you, sir. Thank you for that short and brief. Please clap for him. They are Hospital Management Board. We no get Reef Chip, no get hospital. They make things work for hospital. So if they close their door, thank you, sir, for the goodwill message and supporting us. Let's also welcome the goodwill message from the Red Cross Society, Rivers State Chapter, Mr. Dema. Put your hands together for him. Please don't, I encourage us to not go yet. After the program, we are rounding up. We will have a package for you, so at least for your transport fare. So if you don't mind, please stay back so that you have your envelope.
Good afternoon, everyone. I remain on the existing protocol. The Nigerian Red Cross Society is an organization that is set up by the government to help in the health welfare scheme. And today we are here to support this River State Contributory Health Protection Program in River State. It's very laudable because health, they say, is wealth. And today, I stand to say that the Nigerian Red Cross Society is a voluntary-based organization, and as a voluntary-based organization.
Sorry, please, can we reduce the noise, please? Please, can we reduce the noise, please? If you need anything, just the protocols are there to attend to us, please. Thank you very much. Yes, sir.
Thank you very much. As a voluntary-based organization, we have a wide range of volunteers spread across the River State. And because we have that widespread of volunteers, we will ensure that we contribute in a way of disseminating information to the local communities wherever the Red Cross exists. Because we have the structures that spreads from the state, which is the branch, and we have a structure at the divisional level in all the 23 LGAs. And in the 23 LGAs, we also have the structure of a detachment level. So this is a very laudable program by the River State government, and I would like to thank the Executive Secretary for making this possible for us. Some persons will not understand it deeply. When I look back and I see the different packages that are spread, if you look at it, I think it's something that is affordable, and if we encourage our community members to participate in this laudable program, it will go a way to help everyone who cannot afford the health whenever they have issues of ill health. So I want to thank the governor. I would like to thank the deputy governor. I'd like to thank the RIP chief for making this possible, because in time we'll become an beneficiary to this program, and we thank you everyone who had come. Continue to spread this message across, and we will have good health in our communities. Thank you very much.
Thank you, Red Cross Society of Nigeria. Thank you so much. We deeply appreciate your... We are wrapping up, but before then, let's please welcome Mrs. Helen Odega. Mrs. Helen Odega, IFAROH Secretary, for our goodwill message. While she is coming, we will also want to welcome and recognize and also welcome for a goodwill message Pastor Mrs. Oko Jaja. And we understand you are here with your husband. We recognize you, we celebrate you. And please, you will be coming for a goodwill message. Pastor Mrs. Oko Jaja, the President, Sisters Fellowship International. We celebrate you. Please, Mrs. Helen Odega, can you step forward for a goodwill message? She's not here. Okay, please. Let's welcome Pastor Mrs. Oko Jaja. Pastor Ms. Oko Jaja. Okay, while she's coming, we also want very Otobo, the season coordinator, CSOs coordinators, something. Okay. Okay, ma, she's coming with her husband. Thank you, ma. Please, let's put our hands together for Pastor Mrs. Oko Jaja.
Praise the Lord. Started on existing protocol. Pastor Mrs. Gloria Kennedy, standing on behalf of Dr. Mrs. Lane Okujaja. I want to thank God for today. I want to appreciate God for all He has done and all He's about to do, especially in this great program. God is faithful for using our governor and all doctors involved to give succor to some members of this state. I want to say, may God bless you in the name of Jesus. For all you are doing, for your good works, for everything. I want to say thank you. Thank you, and God bless you in Jesus' name.
Thank you, Ma. Next, for a goodwill message as we wrap up, welcome Mr. Otobo Dennis for a goodwill message on behalf of the civil society organizations of Nigeria. River State, please.
Good afternoon, everybody. My name is Dennis Otobo, lead CSO, all CSOs working within the health sector. For me, I'm delighted that today Reef Ships become a household name. Most persons do not know how it started. It's over 10 years ago. When we started, I think only 3 persons in this hall are part of that team. Today it has become a household name, and people are coming to say their testimony, how they've been beating. So we just hope that Ships will keep spreading stronger. I also want to say what our father Awuse said, that the government should please reduce the price for the rural communities, because when you interact with them very well, you know that most of them want to get involved. But they cannot bring out that 25,000 at once to pay that price, because some of them, look, their income for the month is not even up to 15,000. They are just from hand to mouth. So Real Ships to meet up its target, which is mostly the vulnerable population, I'll plead this goodwill message that they should try and make sure that the 15 that they were taking before should be continued while they look at these other classes, those who are earning salary, to see how they could make that adjustment. I would say thank you, Real Ships. Thank you, Dr. Betty Agala. You've done so much. Many people may not know the history that Betty Agala has been on this job for been appointed as a executive director. And when we started, nobody knew that she would be appointed the executive director today. So Betty Agala, thank you. Real Ships, thank you. But make sure that you capture my rural population, which is my own primary concern. Thank you.
Thank you very much. Thank you very, very much. Let's also recognize His Royal Highness Tubo Tamono, His Royal Highness Tubo Tamono Asifumebia Dick Ijo III, JP, the Amanyanaba of Opurama. He is representing the traditional worshippers. Traditional worshippers. Please come for a goodwill message for the traditional worshippers.
Even if I was the last person to speak, I will still speak. Because I know it's a protest. I know it's an aberration, and I must be here to correct it. When you go to court, they ask you, are you a Christian, Muslim, or pagan? And section 38 of our constitution, that is chapter 4, guarantees religious worship. Please, in government function, don't silence the traditional rulers. I know that the pastors, the clergy have powers, the imam, they have power. But believe you me, more power lies with us in the communities. I can tell my chief priest to make a proclamation that today nobody should go out, because we want to do a traditional something. And what is that traditional something? It is Real Ships. So don't silence us. I'm speaking here by protest, but this Real Ships we are talking about is each time I have to pay a bill for somebody from home, from my family, which is very large. I now remember that government is always announcing Real Ships. And then the bill will now be around 60, 70, sometimes 100,000. But I know that I have experimented with retainership with hospitals. And sometimes it is beneficial, because sometimes you get 2 days of even hospital admission. So Registering with 25,000, though I don't want to contradict the last speaker here, for the rural populace it should be cheaper, but it is still good. I want to assure you that the Traditional Rulers Council have spoken. My Majesty Eze Bakabaga, who is the head of the Christian traditional religious leader, and the Muslim traditional leader is seated by himself. I'm supposed to sit there. But here, even Red Cross have spoken. And I refuse to go because I want to speak. Next time, if you don't sit me here, once I see the Baka, and I will come and sit here, representing the traditional worshippers. We were here before Christians and Muslims came, please. We are here, and we are still here. I'm a young man, and you know the funny thing, both of them are fasting, no? So they did not eat. I ate, and I have more strength to talk. So, rivers people is something that we must embrace. See, when you go abroad, on a more serious note, when you go abroad and healthcare is cheap, it is because of the insurance scheme. It's because of the insurance scheme, because not everybody falls sick at the same time. So those who are not sick, subsidize for those who are sick. So let us embrace rivship, and I know that healthcare deliverance will be made available to all.
Thank you. Thank you. Put your hands together for the traditional worshippers. All right. So he was protesting, very serious protest. He was protesting, and he told me that he will not go from this place if we did not recognize traditional worshippers. But we want, all what we want is the message be passed. Whether you are a traditional worshipper, whether you are a Christian, a Muslim, you need to be in good health. That's the message, isn't it? You need to be in good health. In fact, traditional worshiper leader, what you will do that will make us, in fact, you will be the first person who will always put in a goodwill message. As you go now, just enroll 1,000 traditional worshippers. As you enroll, that is what we want. Lives to be saved. Thank you very much. Let's put our hands together once again. Let's recognize, just a recognition, not for a goodwill message anyway. After now, we'll go into section. As I step out, some persons told me, said there is a burning question. Something is burning in my heart I want to ask. I said, don't worry. We'll give you that little time. We'll wrap up this program by 1. We have a very few minutes to 1, and everything will wrap it up. Please, let's recognize Pastor Alinri Ikecha. We also recognize Pastor Samuel Irualo. You are welcome. We also recognize Pastor Jackson of the Winners Chapel International Army Range. We recognize Pastor Steve, yes, of the Assembly, Grace Assembly. We recognize you. You are special to us. Thank you so very much. Thank you. All the ministers that are here, we recognize you. All the traditional worshippers, all the royal fathers that are here, we recognize every one of you. Thank you. Civil society organization, we celebrate you. At this juncture, we will be moving to an interaction section from the presentation from what Reef Chip represent. If there is anything that it is not clear to you, you want to be more educated, you want to be very sure that that's what you heard, you can ask. Yes, you want to seek for clarity, we'll give a few persons opportunity to ask. And as I earlier said, that this program will be wrapping up by 1. So we have about 10 minutes more to wrap up everything. So if you have a question, please can you signify with raising up of hand? So I will be recognizing the hands. Number 1. The chief imam. Yeah, okay. Number 2, 3, 4, 5, 6, 7, 8. All right. So that's okay. So please, we'll be calling you to come up. Let's also recognize the presence of Right Reverend Dr. Timothy Prestige, JP. We also welcome the presence of Bishop. Okay, I think Right Reverend Dr. Timothy is the Bishop, the Diocese of Johannesburg, South Africa. Is the Bishop, BLBC, Diocese of Johannesburg, South Africa. You are welcome, sir. We recognize you. Right Reverend Dr. Timothy Prestige, ADLA, JP. You are welcome, sir. We recognize you. Please, can you clap for him? He flew down from South Africa down here for this program. Oh, we recognize you, sir. We also have Alaji Hassani Isa Madaki, the Serakim. Wow. Okay. The Serakim Hausa what? The Serakim Hausawa of River State. We recognize you. Serakim Hausawa of River State. We recognize you. Thank you, sir. You are welcome. We also recognize the presence of Pastor Paul. Oh Lord, Pastor Paul, you are welcome. You are welcome. I was thinking it's our Paul, the Auditor General. But he told me he's also a pastor. Auditor General of Rift Chief, where are you? Okay, step out. Please, number one. Please, can we have question number one and number two? Please, number one, can you come forward, please? Just step. Number three, please follow. Okay, take the mic to them. Take the mic to them. He's still on call. Take the mic to her. Thank you. Please, your question straight to the point.
I'm Jane Omono Apollos James of Legal Care Advocacy Foundation. I want to once more thank the organizers of this program and our dear Executive Governor River State. Now my question is, from the presentation, I wasn't clear about the different facilities, the hospitals that are meant to partner with, the indigents, or sorry, the residents of River State. I only heard that BMH is a secondary hospital. So please, I want to know all the facilities that we are meant to register with, especially, is it that you get your NIN and go to these hospitals, or there is a particular place you will register first before getting to this primary health care?
All right. Thank you very much. So we will be calling some persons who will be answering this question. But this question, two questions that she has just asked. One, where do we register? Where do we register? So, one, our office, Water Lines, the remodel building, Water Lines building, remodel building, we are there 247 to enroll you if you walk into that place. In all the local government, we have what we call our focal persons that are in all the local government enrolling. And apart from that, we also move out from community to community to do enrollment. We are also advancing shortly from the facility. You can go to the facility and they will direct you and how you enroll. But most importantly, you can enroll yourself. We have self-enrollment. Please, ma, do you have the program? Look at the program. Do you have the program? Look at the back of that program. You see a barcode. This is not just a program. It's a digital program. At the back there is a QA, a barcode. So you can scan. Once you scan, it will take you to enrollment and you enroll yourself. You can do self-enrollment. Of your organization. Yes, so if you want to enroll your organization, come to our office or invite us we will come and enroll, depending on the number. So that is it. Now, concerning the facility where you are to, almost all our model primary health center in the state is part of it, over 214. All the general hospitals are on board, 18 private hospitals. Now, at the point of your enrollment, we will tell you the nearest hospital to you. You will choose by yourself. While you are enrolling, you will see the list of the hospital. It's on board. So it's not something you will be moving around, looking for where you will go to. Thank you very much. Question number 2. Please bring the mic to Imam. Then I will be calling of the management team members to answer the questions as it relates.
Thank you very much. My question goes like this. There's a lot of silence on where caregivers, care centers, the hostile attitude that is this care seeker. Based on our experiences during organization monitoring, we discovered that some attitude, there's nothing that happen. This is the that we don't get people.
Thank you. I think ES will give the mic to the ES. ES will address that, and ES will address that. Thank you very much. Question number 3, please. Okay.
Thank you very much. The issue of quality of care, why we are here, they are all part of the facility. At the primary health, at the engaging, getting demand, engaging at the supply side. There's something about Rift those that have enrolled kind of have a phone, reach out to us at the point of where something is happening. Human beings are human, cannot or determine how all the health workers. Health insurance is also new. They are not collecting at the point of service. And you know how we are. Now monies are paid to the. A lot happens. They are learning and they are getting. So all of us, something. That's the only way. No. So if there is a out, Dr. can attest to, and the people at the primary health, we are constantly on them to ensure that they are providing the kind of service vision that people. As for groups, so groups may not be able to one by one go, and so you can reach out to us and we'll work out how you're enrolled as a team under an umbrella. We talked about organized private sector, so we have companies that enroll their staff. You understand? Those people, they don't enroll as individuals. We want to have you in a place so that when company pays or people are paying, we know that it's for this company because it is an annual payment. So after a year, you must resubscribe. And so if we don't put you together in those cohorts, then it will be difficult for you to be covered by that umbrella. Secondly, eligible people are the ones that are sent to the facility. So as you know, you have registered. The hospital where you choose to go to also have your names. You understand? So don't worry, we are all in this together. It's not perfect yet, but the idea is to make it better and better. So sir, please, we'll work with you and your community to ensure that health seekers get the right attitude from health providers. Thank you.
Thank you. Please, question number 3.
Praise the Lord.
Hallelujah.
My name is Bishop John Ogolo, and I'm the State Chairman of Niger Delta Indigenous Bishops and Ministers Forum. My President General have just spoken. I want to ask a question. Number one, in relate to what they said, do we have a kind of hotline where we can call when they are in those facilities? Number two, what is the scope of your insurance registration? For me, let's say I'm a father, husband, and I have about 3 or 4 children. Where my registration covers my whole family, I really need to know about that. Thank you.
Okay, that's noted. We'll take number 4. Give the mic to number 4 so that we can take that together.
Good afternoon, everybody.
Good
My
afternoon.
name is Alexander Comforts. I'm a clinical and mental health. So my question goes thus. Knowing the increased psychiatric concerns and psychological distress that comes with physical health conditions, I would love to know if Reef Chip has plans on integrating mental health services, existing enrollment activities, or benefit to people who register for their program.
Okay, let's also have our ears to take that 2 questions. Question 3 and 4 together.
Thank you very much. Question has been covered. Our phone numbers are on. Please, this brochure is not just those picture brochure that we drop. It contains vital information that you would use beyond today. Frequently asked questions are there. The questions that over the last 2 years people ask us. We have identified them, we have put them there so that you can see the responses. So please don't throw away. I know that there are so many programs, but this particular program is an IEC material in itself. So the numbers are there. Now we have plans. When we say 25,000 is for an individual. A family of 5, father, mother, 3 children, it is supposed to be 125,000. We have a plan for a family of 5, which is 120,000. So every family is not the same. It is only in the formal sector where when you register, it covers for you, your spouse, and 4 children under the age of 18. And that is because the employer is paying a part of that money and the employee is paying monthly. That's how it works, even for the organized private sector. So yes, regardless of how many wives you have, how many children you have, he's smiling. Yes, because some of us have more than 1 wife, isn't it? So if we follow protocol, it will be 1 wife and 4 children. But we have allowed everybody to express themselves. Every individual can be covered. Okay? Our program. If you have a family of 5, you would have to click to say my family is 5 people, family is 10 people, and then automatically how much you. It's a digital system, or you reach out to us directly, someone can enroll you. If you want to go digital, you do that, the system calculates, pay online, and then gets the end. The question on mental health, and I knew that she would ask that question, is that one of the things that Reef Chip had to do our health. We talked about health seeking. More importantly, we are talking preventive. How many of us know that even if Reef Chip pays all your medical, pain will remain with you? Hello? It is you that will bear the pain. We can only pay the money. So we are interested in you being healthy. The idea is that you are healthy because that's when you can be productive. That's when family will have the full benefit of you being around. So we are integrating preventive health care. I know we have a group for men that are 40 to 60 years old, right? And so on that group that are registered with us, of course, on that group, there are health tips that come on, have you gone for your prosthetic screening, all of those things. We have a group for pregnant women. So we are trying to ensure that even though you are registered, you don't fall sick or you don't have to go to hospital because you're sick. You can go to the hospital for a check. And that's fine. If all of us are able to check ourselves, check our BP, not drop dead, without knowing what they have in. So mental health, yes, we'll work together to see how we can put in some preventive mental health tips for our enrollees. But the neuropsychiatric hospital is the provider, and I know some of our clients that go there and are assessing. We also have basic mental health, what do you call it, primary mental health care covered in our primary package, anxiety, depression, all of those things. So I think to an extent, everything is covered. That brings me to the benefit package. Our benefit package is quite robust. Get it anywhere for, and that's because the government is heavily subsidizing. So you have communicable diseases, common diseases, malaria, typhoid, respiratory tract infection, all of those are covered. Non-communicable diseases like hypertension, diabetes, arthritis, they are covered. Someone was here talking about kidney disease, which is becoming very common. They are covered up to the number of dialysis, covered, after which you may have to do. So it's a robust plan. Don't wait and say, I'm not, my case is not mentioned. We're doing cataract surgeries, we're giving glasses, dental care. But we will not do braces for you. No, we won't. That's not an essential service. You want to do braces, then you can do braces, isn't it? If we will do orthopedic surgeries, but we will not do serious things and pay for it under 25,000 when you need a plate. I don't know whether you understand. Except there is an emergency, there's an RTA, for which we also have a plan that covers emergencies. So I believe that our packages are robust enough for everybody, men, women, children, both, and thank you. Thank you. Yes, I think it was Majesty that talked about reducing the amount for the vulnerable. So we are going to have what we call a phase 2 enrollment for vulnerable people. What we need us to do is invite us, gather your people that are vulnerable, whether they are over 60, they are under 5, they are pregnant women, persons living with disability. That's so that they don't. So if you have these people, what you can do for us is to make sure that these people have their national identification. Because if you don't have NIN, you're not a Nigerian. And the money is coming from the federal, and so they need to identify the human being that we claim to be paying money. That person is not paying. So this is part of our responsibility. Our people are enrolled. Only children 1 year and are exempted for now. So children 2 to 5 who can be registered free may not be if they don't have NIN. Yesterday we unveiled some NIN machines, just 6 of them, not enough. So we still, and if you have done something with NIN, you will know how slow. So we need everybody to be wherever they are. When we come, we're only coming to need to help. Thank you. I hope I've been able.
Thank you very much, ma. I hope you get that last point, that for the vulnerable, we will soon enroll the phase 2 where they need not to pay anything. And your role will be gather them. Make sure they have NIN. But when we come without NIN, may they see you. Thank you very much. Please, you make use of that window. Make use of that window. Beyond the 25,000, so on. Thank you. Question? I think there are some hands that were up. Okay, question number 5 and 6. Sir. Okay, you are the one that came. You are the Zacchaeus that came down. Please, let's just give him a privilege. He was the Zacchaeus. He was shouting up. Yeah, and he came down. Sir, please ask your question.
Yeah. My name is Apostle Godwin.
Welcome, sir.
She, National Pastor, Hoktro. President is here. It's quite a good package, really. A package like this mitigate debts, mitigate costs, reduce people who stays at home for want of a lack of money for treatment. But then, I've also seen various packages from the brochure here, and then each of the packages here only define the applicable benefits, and then the borders of where each package will stop, and the exempted cases are not properly defined. And then number two, I think Madam has simplified something here. I wanted to find out, because each insurance policy is always having some age limits that, covers will no longer be necessary. Does it apply to your packages as well? This is the clarification I want to hear.
Okay. Thank you very much. Mambona, were you listening to that question? You're not sure. Anyway, okay, so, sir, were you listening? Okay, yes, please give him the mic to respond to that.
Yeah, thank you very much, sir.
Please, this is a Reef Chip call center number. You can pick these numbers. They are 247 anytime. 1 a.m. anytime. You can call.
Please, sir, can you listen? You ask a question. In Reef Chip, you understand what our executive secretary was saying. We have 60 years and above. We have 0 to 5 years. We have vulnerable groups, so there are no limits for age. We cover all the ages.
Please clap for, if you want to clap for it, clap now. We cover all the ages. Even if you are 90 years, we cover.
And you also talk about the benefit package on the brochure. Each of the package there have different. You observe very well, you see 1 or 2 things that are different from each other. That's the premium. From 25,000, 38,500, 68,500, and 98,500. That's the premium we have for now. Thank you.
All right, thank you. Just to add up to that quickly, I think what you were asking, the exemption, if you listen to, yes, when the ES was saying, we don't do cosmetics. We don't do cosmetics and plastic surgeries. Yeah, so that is all. I will not give you Gucci frame for your. Thank you. Please, next question. We need to wrap up now. We need to wrap up. Question 8, 9, and 10. 7 and 8. You are the one keeping us. I wanted to close by 7. Please give by 1 o'clock. Give her the mic. Who is it? 7, please. 7. Look at him. Look at him. Take 7, 8, 9, 10. Just together. So that we'll wrap it up.
Good afternoon. My name is
7
Mike.
and 8. Yes, sir.
My question is, during this registration, yes, and specific hospital.
Dr. Juliet, please listen to the question so you would answer the
You
question.
assigned a specific hospital that maybe is. I want to ask here, you're from Ghana, for instance, registered here in Port Harcourt. Maybe you were assigned travel to Ghana, for instance, got sick there. Possible for someone who is registered here in Port Harcourt, treated anywhere, Ghana, or outside River State, the case may be.
Please take number 8. Take the next question. Where is the next person? Look at her there. Look at that young lady there. Give her to ask her question. She will take it together. Yes.
Good afternoon, everyone.
Good afternoon.
I'm Chinda Gift, coming from Justice and Empowerment Initiative. Talking based on Elele Health Center. When we started this, we heard about reach around the community, telling our people, sensitizing our people, and we bring them to the health center. That is what I'm saying now. I think Dr. Vetty should be aware of it. Because when I bring these old women to health center, they come back telling me they left without drugs. So the day I went to Reef Chief office, she said she was in a meeting, so I have to drop the message. That I noticed that Reef Chief clients coming to the health center, they end up going back without drugs. So I want to know where the fault is coming from. But
okay.
Somehow they did something, but the one they are doing now, if they write text for somebody, they will tell you Reef Chip is not covering this one. So I want to see if they can put it in a hard copy so that I'll be able to tell them Reef Chip is covering this one. Because common malaria medicine, they will give you like 2 and tell you go and buy the other one. Reef Chip is not covering this one. And secondly, please, now that we are going to another phase, is there any way they can position a Reef Chip client or somebody that is representing Reef Chip on each of our health centers so that they can be monitoring Reef Chip, what is going on with Reef Chip client? Thank you.
All right. Is there any other? The last one, please. Last question. Okay, no. All right. Thank you.
I wish my directors of primary health care answer the question. Yes, please permit me to call on a member of Reef Chip Board and one of the directors at the River State Primary Health Care Management, Sunday Sochi to please help us answer this question. Thank you, ma'am.
Thank you very much for that question. Now, what we are trying to have done that clarification for the staff facility that they are not separate pharmacy. It's one pharmacy. And there are no drugs with cheap patients and other patients. So where there are issues like that, ensure that they are reported and looking, because we have addressed sure that the patients are taken. However, another thing we must know, if you look at that brochure, a certain number of times you are supposed to attend. Sometimes you find that people abuse the needs of their care. Remember that is being paid for. So sometimes they have to be limited by the number of times they are entitled to attend. If not, it takes so much of the fund that they can't take care of all the people. I hope I've made it. But please, where there are issues that arise, where patients are not properly taken care